today's Wellness Wednesday focuses on chest pain. When is it a problem? Joining us now is Chris Bell, an acute care nurse practitioner at Cardiology Associates of North Mississippi. How are you, Chris?
Excellent, Tanya. Thank you for having us here.
And thank you for joining us. So tell us a little bit what you do at Cardiology Associates.
Sure. Cardiology Associates of North Mississippi is a large practice. We have 20 cardiologists, 12 mid-level providers, and we offer a wide spectrum of cardiovascular disease processes and therapies, and really quite contemporary and up-to-date, even with a lot of research, and many people don't know that.
Wow. Now, when it comes to chest pain, when is it a problem? What are some of the symptoms people need to really identify?
Yeah. Great question. We have this every day. People come in and they're concerned about chest pain, and maybe it's from gastric issues or whatever. But if you have a sudden tightness of your chest, penetrating pressure through the chest, through the shoulder blades, those radiating pains down the arm or up the jaws, particularly if they're associated with activity, stress, or strain, and alleviated with rest, oftentimes those are concerning for cardiovascular type chest pains, and not necessarily the gastric pains or other pains that can be associated with similar type findings.
And when it comes to chest pain, when is the most important time to get medical attention?
Absolutely. If it's recurrent and unstable, if we ever have chest pain that's associated with nausea or vomiting or breaking out in a cold, clammy sweat, that's always a concern, because that's a systemic response. And if that chest pain seems to be escalating with activity, particularly if you find yourself having to limit activities to avoid the chest pain, or that chest pain is associated with other type processes like shortness of breath, waking up shortness of breath, irregular rhythms, then that's very concerning, and you would certainly want to see healthcare providers. Maybe start with the primary care if it's not really distressful, and ultimately we'd be happy to see those folks to help them navigate those symptoms and see if they have obstructive heart disease.
Now, when it comes to folks who may think they have chest pain, but then, they're just like, oh, you know what, forget it, I'll go to the doctor tomorrow. What's the biggest mistake they make?
You only get one heart. And sometimes if that heart is bothering you to that degree and you recognize that there's a problem, it's much better to have that checked earlier than late. And we even offer some services now for preventive screening that looks for heart disease before chest pain and before symptoms can even emerge. And if that's something patients are interested in, that's something that we can do to make sure we're addressing those vulnerabilities and risk factors before they ever have an event.
All right, then. Well, thank you so much, Chris Bell, for joining us this afternoon.